So I was born and raised in Lagos, Nigeria. My mom was a single mom with three kids, just trying to make ends meet. And we had the fortunate opportunity to win the US visa lottery. And so we immigrated to the United States in 1997. I attended college at the University of Georgia. That was sort of the time period where I started to explore what my future was going to look like. Luckily, I got a job working for a congressman after college. And I think that was sort of the turning point in my life because, when I was working for the congressman, I realized that there was a really big disconnect between policymakers and the people that actually take care of patients. So I knew I wanted to bridge a gap in clinical medicine as well as healthcare policy. And that was sort of what brought me to UCSD in San Diego. Yeah, unfortunately, it's still quite a male dominated field. If you look at overall enrollment in medical schools and in residency, there's a lot more balance in terms of women. And even some residency programs have predominantly, women or, 60-40. But the experience of being a Black female in surgery, especially, is extremely challenging in many aspects, not just with working with patients. Sometimes it could be the staff. Sometimes there's some experiences that you have that only the environmental services people that come or the people that are dropping the mail are the only ones in the hospital that can actually understand you. And so I think that is a very kind of unique aspect of, despite being at this point in my life, I still, was very surprised the kind of reception that I got being in my own country, providing the same service that I would otherwise provide anywhere else. I love my job so much. I don't know if I was born a surgeon, but I was definitely made a surgeon. I think just the fact that I can heal with my hands is so fascinating. There's nothing more satisfying by coming to the recovery area and telling a patient, like, we got all your cancer out. And these are patients that have been on chemotherapy and radiation and have gone through so much once they've had a cancer diagnosis. And so I just love the art of healing with my hands. I feel like it is so rewarding. I do a lot of health policy and all this stuff. I tell people all the time, I may not be able to change the entire healthcare system in Nigeria, but man, I can help a lot of people. I am still a surgeon with a knife, without a robot or anything. I can still help people. And so I would say that's the part that I find very rewarding for surgery.